Hello and welcome to the Greensboro Doula YouTube channel. My name is Sandra Nishihata and I'm the owner of Greensboro Doula. I'm talking with you a little bit about planned cesarean sections or cesarean birth and how you can prepare for that or what to expect when you have cesarean birth. A planned cesarean has for sure the advantage of planning things in your life around it, and you can prepare for your recovery time and set up a team around you. So if you're at a hospital and you're talking about your care provider for whatever reason to have a planned cesarean birth, he will talk with you about the risks that are going to happen or that are there when you have abdominal surgery. And he's talking with you about options for anesthesia. You can have an epidural, which would keep you awake and just numbing you from below your hips, so you're not feeling the actual surgery. You would still feel some pulling when they get your baby out, but the pain sensation is going to be gone. Then it depends a little bit on the hospital policies and the things they have available. There are hospitals who give you the chance to have a clear drape, so while you're laying down and you have your cesarean birth done, you are able to see what they are doing. You're going to see your baby be born. That's also possible when they lower the drape a little bit. Having no drape at all is very rare. There are a few hospitals offering that, but it's usually common to say, hey, can we lower the drape a little bit so they can raise the baby up to you so you can see the baby right after birth. All hospitals around here support skin to skin right after birth, and it is something you should take advantage of. As long as you're doing fine and your baby is fine, there is nothing that speaks against it. Again, please talk to your care provider about the procedures that he or she specifically is performing. You will most likely be strapped down on a table. Your arm's going to be strapped down just to make sure that due to the anesthesia you don't start shaking or moving your arms around and risking major injury when someone is operating on you. And you're going to have one support person in the room, which can be your partner. If your partner is not going to be present, most hospitals will allow you to have your doula instead in there. They're going to be scrubbed in too, so it is safe and sterile for you and your baby. And this person is usually standing or sitting right next to your head, so you can communicate during the cesarean birth. After birth, you are going to go into a recovery room to let your anesthesia wear off, where you are closely monitored to see if there are any complications, and it depends on how you're doing when you get admitted to a room together with your baby, and you go from there. You're going to get medications against pain to reduce the pain sensation for your incision, and someone is explaining everything to you. You're going to go home with pain medications. You might not be able to hold your baby as much as you want to because you're going to be under medication, and they want to make sure that you don't drop your baby. So organize that you have someone in the room with you all the time, so someone can watch you and your baby and give you the chance for skin to skin and bonding with your baby. Okay, I hope you have a wonderful birth experience and have a wonderful day. And check us out under greensborodoula.com. Bye bye.